Alright, welcome back everyone to Medicine in the Moment. As I promised in the last video, we'll be discussing artificial intelligence today. Basically, I want to try to give you a good idea of what artificial intelligence is, some examples of how it works in practice, and also how it links back to the things we've already discussed. So let's get into it. Okay, first, most important question, what actually is artificial intelligence? Well, there's a lot of different definitions for it, but the most widely agreed upon, or the textbook one, if you will, is a branch of computer science that is dedicated to creating systems that can mimic human intelligence. And what these systems are supposed to be able to do is perform highly complex tasks, like recognizing patterns in pictures, actually producing human speech, and many other things. What artificial intelligence comes down to is really just identifying and remembering patterns, which is something humans are very good at, but computers weren't really up until recently. And in fact, now, computer systems are a lot better at certain complex tasks than people are. An example would be solving Rubik's Cube. I personally suck at solving Rubik's Cubes, so I know it would take me a laughably long time to solve one. But even the fastest Rubik's Cube solver in the world, a man named Yusheng Du, set a time of 3.47 seconds. Can you guess how fast an AI-powered robot was able to solve the Rubik's Cube? 0.38 seconds. That's around 9 times faster than Yusheng. By the way, if you want to see the AI solving it, I linked the video in the description. So obviously AI is an extremely powerful tool, and I'm sure you can't help but think, well, can it be applied to medicine? And if so, how? The short answer is yes, it can be applied to medicine, and it's actually already been applied many times in the past. In 2020, the AI and healthcare market was valued at $8.23 billion. By 2030, this value will reach $194.4 billion, with a compound annual growth rate of 38.1%. That is huge. So I want to dive in to think about this growth a little bit more, namely, why is it happening, who is it impacting, and how is it happening? To answer the first question, why? Well, it's kind of because of a combination of two things. On one hand is something we discussed in the last video. There is a really large availability of medical data, or big data. On the other hand, there is a shortage of skilled professionals, whether that's doctors, nurses, etc. I'm sure physician shortage is an issue many of you have heard about. In fact, the Association of American Medical Colleges predicts that there will be a shortfall of 139,000 physicians by 2033. The causes of this? The main one is that we're living in a rapidly aging society. While the overall population of the US is expected to grow 10% in the next 15 years, the over 65 population is expected to grow by 45%. Basically, this means that doctors will be retiring at a rate faster than new doctors are being hired. This is where AI comes in. When it comes to handling data, it can do most of the stuff that people can do, and do it better too. To answer the next question, who will this growth in AI impact? Pretty much everybody. That includes healthcare providers, biotech and pharmaceutical companies, patients themselves, and other stakeholders as well. You can see from the chart in the top right corner that healthcare providers and companies will experience relatively more impact than patients, but the impact is there for each group nonetheless. And finally, how will this growth in AI occur? This is what the chart in the bottom right corner shows. AI will produce all kinds of novel technologies, from robots that can assist with surgery, to virtual nursing assistants, to tools that can identify participants eligible for clinical trials. In the next few slides, I'm going to be discussing some of these technologies in a bit more depth, just so you can get a better idea of the amazing things AI is capable of in healthcare. First off, we have medical diagnosis using AI, which is particularly huge in the field of radiology. If you aren't too familiar with radiology, basically, radiology is a branch of medicine that focuses on using medical imaging to diagnose and guide the treatment of diseases. AI is big in this area because, as I mentioned before, one of the things AI is good at is identifying and remembering patterns. And of course, this also means patterns in images. Just like how radiologists train their brains to identify certain abnormalities or anomalies in medical images by looking at many images over time, you can train an AI in a very similar way to perform the same tasks. The AI-powered imaging and diagnosis market is expected to grow by 40% to over $2.5 billion by 2024. FDRN, a recently invented computer system that can mimic the structure of human neural networks, is capable of performing accurate MRI analysis within seconds. There's actually been a lot of debate around the idea that AI may replace radiologists in the future because it's more efficient and less costly. My personal belief, however, is that AI will not replace radiologists because the role of a radiologist is much more than just analyzing images. Radiologists are actually data communicators. They're responsible for taking whatever interpretation the AI produces, verifying it using their own knowledge, and communicating the final result to patients and other clinicians as well. We also have artificial intelligence being implemented in medical assistants. Recently, these technologies called virtual nursing assistants, or VNAs, have sprung up. Essentially, they're AI-powered systems that provide personalized treatment to patients. And what they can help you do is provide accurate clinical advice, directions to emergency departments or EDs, schedule appointments with your doctor, connect you to a nurse helpline, and give self-care tips. So this company, Sensely, released a few years ago this avatar and chatbot-based VNA that you can access from an app on your phone. You can see the app interface on the left. And you might also be able to infer that these VNAs are particularly useful for people that have, for example, trouble keeping track of their medications, or who don't have easy access to the hospital, or who have trouble independently scheduling their appointments. Then there's AI in chronic disease prevention. So how many of you have devices like Apple Watches, Fitbits, or Garmins? What we call these are wearable health trackers. As those of you who do have these devices probably know, they can tell you a lot of stuff. They can tell you your heart rate, how much you've exercised in the day, how much sleep you got last night, and so on. They're continuously collecting data from your body on parameters like heart rate, activity level, sleep cycle, blood pressure, and breathing rate. The idea behind collecting these specific parameters is so that you can look at them and feel motivated to take charge of your own health. This way, you reduce the risk of developing chronic diseases associated with poor cardiovascular health, like heart failure and coronary artery disease, which are actually some of the most deadliest diseases in our society today. Finally, we have AI being used in medical procedures as well. By combining sophisticated mechanical and more hardware-based systems with software-based systems, we can create robots that help improve surgical efficiency and reduce case-to-case variation in surgical procedures. An example of this is the Da Vinci surgical system, which was invented in 2000 and has been used in a wide variety of healthcare settings since then. And the cool thing about these surgical robots is that they allow for minimally invasive procedures, meaning procedures that involve minimal damage of bodily tissue. So the picture on the left, taken from an actual surgery, kind of shows how a surgical robot works. These are by no means, the kind of fully autonomous surgical robots from Alien, for example. Rather, they work hand in hand with the surgeon to perform the surgery. The surgeon sits at what is called the console on the left, looks at the surgical site, and performs all the normal hand movements he or she would if they were actually operating on the patient. Their hand movements are then translated by the robot, which actually does the physical incisions and stitching on the patient that's lying on the bed. So clearly, we can see that there's a very wide range of applications of artificial intelligence in the medical field. Now I want to talk a little more about artificial intelligence just as a field and what different branches it has. I think this will be important, especially as we start moving into some of the finer details of machine learning and deep learning and whatnot. So I like this diagram a lot. I think it summarizes all the branches of AI pretty well. Basically, there are 7 main branches. There's machine learning, or ML, natural language processing, also known as NLP, expert systems, machine vision, speech, planning, and robotics. I'm going to get into more detail about some of these later on, but for now, I'll just give a brief overview of each. So, machine learning is the branch that focuses on using data and algorithms to imitate the way that human learning occurs. It uses data to sort of teach things to a computer, allowing the computer to complete a set of tasks without being explicitly programmed. NLP is essentially the study of how computers and humans can communicate with each other in natural language, like English or Spanish. An expert system is an AI that can replicate the knowledge of an expert in a particular field or subject. Machine vision is a technology that allows machines to visualize their environment, detect objects, and make decisions based on that visual input. And then speech to text is similar to NLP. It enables the recognition and translation of spoken language into text, essentially. Planning is the branch of AI that deals with optimization and finding the best path toward a given objective. And finally, robotics is what we discussed earlier, creating programmable machines that can carry out complex tasks to help humans. So this might seem like a lot, but we'll slowly explore some of these different paths and see how they're relevant to medicine. Before I conclude, I want to introduce one new concept, data science, and then tie everything together. So what is data science? Most people agree that it is a multidisciplinary approach to extract insight from big data. But what does that really mean? If you look at the Venn diagram on the right, you can see that big data, data science, and artificial intelligence all intersect with each other. The way I like to think of this intersection is that big data is a source, like a river or a stream. Artificial intelligence is the processing of this data and what allows us to use it to our advantage. So you can think of it like a water wheel generating power for a mill. And data science? Data science is the blueprint for the whole mill, everything from the foundation to its walls to the ceiling. The water wheel is just one part of the mill, but probably the most important part, just like AI is one of the very meaningful applications of data science. So that brings us to the end of this video. In the next video, I'll be getting into machine learning, which, as I mentioned, was one of the branches of AI and is particularly important in healthcare. So I hope you're excited, and I'll see you then.